So areas of the face that can be treated with Botox, most commonly, we treat the glabella, again here, the scowl lines. We also treat the forehead, that's probably the second most common. We treat around the eyes, the crow's feet. We treat nasalis, the bunny lines here. We treat what's called smoker lines above the lip, the marionette lines, and then also the neck bands or the platysma in the lower face. And then we also do treat the masseter that can slim the face, but also if patients grind their teeth or have temporomandibular joint dysfunction, that can help alleviate some of their discomfort. Another very common area is mentalis or chin. We can get chin dimpling or what we call chinulite or cellulite in the chin. Number one spot would definitely be glabella, and that was the first FDA indication. So Allergan, the company that makes Botox, when they first got their initial FDA approval for administration of botulism toxin in the face, the first indication was for the glabella. I would say that's the most common area of concern. And then probably second would be forehead, and then third around the eyes. Occasionally I do have patients come in where their only concern is around their eyes, or maybe their only concern is their lower face or their chin. So it really just is quite variable from patient to patient. Because botulism toxin administration is quite expensive, unless someone has unlimited income and unlimited resources, usually they're utilizing it in their face, but we can use it, like we discussed earlier, for hyperhidrosis, excessive sweating. We can also use it for migraine headaches. We can use it, and this has become a little bit more common as of recent, for muscle spasms, especially in the shoulders and the trapezius. So there are quite a few, even off-label areas. Initially, botulism toxin was approved for contractures. So patients maybe with cerebral palsy or who had very tight musculature, we would inject patients with the botulism toxin. It would get those muscles to relax. And then we went after the aesthetic indication. So really any muscle that is tight, we can often get it to relax with botulism toxin. So we often get patients who come in who are new patients, and they may have concerns that they believe are related to Botox. So maybe their biggest concern is their nasolabial folds and marionette lines, sagging skin, and then they are here to receive a Botox treatment, and that's how they signed up for their consult. There are only certain areas that we can treat with botulism toxin. So as we start to age, we talked about this earlier, our skulls are shrinking, our fat pads are moving south, our collagen and elastin is collapsing in on itself and no longer as robust as when we were younger. So my goal as a physician and injector is to restore the natural volume in the face. So again, there are great areas for botulism toxin that can make quite a difference, but there are also areas of the face that we need to tighten that we are unable to do that with botulism toxin. This is one reason that it's very important to go to a highly trained professional who has years of experience, and they will be able to make the best recommendation for your concerns.